Hi, Meg.
Hi, Anca. How are you? Nice to see you.
Nice to see you.
Yes, well, welcome everybody to the Quorum Initiative Speaker Series. We're very excited about our September session, leveraging the best minds in medicine to help women win at health. We just to let you know, we will be recording the session and sharing the link later. If you're not speaking, if you'll mute your computers, that would be appreciated. If you have any questions, you can drop them into the chat section, and Anca and Dr. McGregor will be answering the questions as we go along. Also, we'll be sending out a follow-up email with a link to their amazing book, as well as a link to contact each of them on LinkedIn, and information about their new platform, OM. So to give an introduction to this, I rarely start with personal items, but this is important to me on many levels. As a few of you know, my first career was in healthcare, and it was many years ago, but I worked as a nurse at a university teaching hospital, thoracic and cardiovascular surgery. It's been 40 years, but we were well educated for the time. And one patient in particular has made an impact, and I've remembered while we were on a floor that really paid attention to people that could potentially have strokes and heart attacks because they were waiting for surgery. We had a woman on our floor that had a heart attack without any of us realizing it. The doctors didn't, the nurses didn't, and it was because we were thinking that she should be showing the same symptoms that a man would show. And we were wrong. It's been 40 years and there's still this type of lack of education going on, which is why I am so grateful for all that Anca and Dr. McGregor and Dr. Jenkins are doing to educate healthcare providers and individuals about women's health and how women's bodies are different. Women's health has been widely misunderstood and underfunded, which is why it stands as one of Quorum's guiding pillars for education and action this year. To help us all better understand women's health, we're excited to be partnering with Dr. Jenkins, Dr. McGregor, and Anca on their new women's health initiative, OM Health Hub. As part of this partnership, we've introduced a series of Quorum Live programs. I'll be sharing the links to those with you in our follow-up email, and they're also available on our website. We have this speaker series session, and on November 15th, Dr. Jenkins will be returning to How as a panelist at our How Women Lead Change Forum, discussing how we evolve women's healthcare, along with two major voices in women's healthcare in the U.S., Carolee Lee, the CEO and founder of Women's Health Access Matters, and Dr. Beth Garner, the board chair of NUA Surgical and the immediate past president of the American Medical Women's Association. Dr. McGregor will be joining us shortly. She's an internationally recognized expert on the critical health disparities between men and women. She's changing the system from the inside, educating healthcare providers and empowering women to advocate for their own health. She's the author and co-author of several books, and her TED Talk, Why Medicine Often Has Dangerous Side Effects for Women, has had over 1.7 million viewers. Dr. McGregor is the director and co-founder of OM, a pioneering precision health platform. Anca Griffiths is coming to us live from Hong Kong, and Anca, thank you for being so gracious, working across time zones with us. Anca has lived around the globe and experienced health around the globe, and this has been part of why she helped found this platform to help educate women. She's also the co-author of Why Women Aren't Winning at Health But Can with Dr. Jenkins and McGregor. So without further ado, thank you. I'm going to hand this over to Anca, and thank you for sharing the book. And thank you so very much.
Thank you, Diane, and so grateful to be able to be here with your amazing community. because really what we're doing is to try to get to women the information that they need about their health. So a little bit about myself, my background. I'm Canadian, but I've lived outside of Canada for a long time. So I've lived 6 years in France, and I've been in Asia for about 13 years now. During that time, my background is not all in health and wellness. I used to work for a big retail group, and it was really with a few experiences of my own where I started looking at what's happening in health closer. So to kind of share what once I moved to Asia, I had 2 children, I experienced some miscarriages, and it was in those moments where I said to myself, well, I'm interested in my health. I look at things, I try to live a healthy lifestyle. Why is it that in these like critical moments in my life, I don't know, one, what's happening in my body, and two, what tools there are to optimize my health, right? And what that came to me because I had, again, lived in North America, Europe, and now Asia. And I saw that different places were doing amazing things when it came to women's health that nobody else outside of these places had an understanding of. So it started from there, thinking, well, where are the tools for the things that we're dealing with beyond, chia seeds and eating blueberries and, this kind of advice that we get about health and losing weight. Like, okay, that's great to have that, but how do I heal, in my postpartum journey? What happens, 25%, 1 in 4 pregnancies ends in a miscarriage. Where's the support around this, right? It's a huge moment in a woman's life. Where are the tools for this? So started looking at the health sector. My background was very much working with consumer insights, figuring out what consumers are like and what they need, and market analysis, right? So I put those two together. Looking at women, we are so proactive about our health. We are invested in our health. We try. We are 80% of consumers of health, right? When you look at for the things that we buy for ourselves and also for our families. When I speak to insurance companies, they tell me, and you're all going to see your partner in this, they have 2 profiles. They have men and women. Women engage periodically with their health. Men is like nothing, heart attack, nothing, big, health event, because they just kind of like put it off. But we as women, we are huge consumers of health and wellness, right? So I thought, well, where are these tools for our bodies going through these very specific things? And so it's started with, okay, I'm going to put together a community of health experts that comes in from wherever they are the best at. Is it pelvic floor coming out of France? Is it heart health coming out of the US? Is it brain health coming from Australia? So finding the best health experts when it came to women's health and getting them to speak and create programs to women in how to optimize their health. Now, we often speak of imposter syndrome and everything, and going into this field as an outsider, I said to myself, like, why are these health experts even wanting to talk to me? Like, why is somebody the caliber of, Dr. Alyson McGregor, who, has basically written the book on women's health, and worked to change the system from the inside, wants to work with me? And what I heard time and time again from these health experts who were deans of universities, head of programs, doctors, physiotherapists, they said they were also frustrated because the knowledge that they had was not accessing women, right? And it goes back to what Diane was saying, like, we've known that women have different hearts to men for over 30 years, right? This has already existed, yet to this day, it's not included in medical books. To this day, the symptoms that women have are, considered atypical when it comes to, to heart health. So, when I started to look at the market and talk to the experts, I realized that we were so far away from actually achieving health. And so that's why we wrote the book, to basically explain to women what's happening in the market, what's happening in the wellness space, what's happening in our own minds, because women's health is like an onion. There's many, many layers. And there's many layers because we've been told for millennia that we're hysterical. You know, like anytime, so one, science didn't understand our bodies, but then when we were experiencing something, we were told that it's all in our head, that we're being hysterical about it, right? So there's the market itself, there's the products, and there's what's happening in our own minds. And we need to kind of understand all that so we can switch how we're engaging with our health. And that's what we put in the book. The book is, you know, it's 3 co-authors, and we wrote, I would say, equal parts in it. Myself, I'm the woman navigating health. Then you have Dr. Alyson McGregor, who has worked her whole career to advocate to get more women in studies, to get women's conditions to be put in medical books, to et cetera, all of this changing the system from the inside. And Dr. Marjorie Jenkins, who also has worked in sex and gender medicine her whole career, but she brings almost like the soul to it, where she tells women, look, I've worked with thousands of women. This is what women experience in the health system. This is what you may experience in the health system. And this is what you should expect, right? So it's a really good, I think, balance between us. And then we brought other health experts from across the world to, you know, give their points of view as well in terms of health. So that's myself and the book. Now, we also have founded OM Health and OM Health Hub. And Health Hub is basically a place where you can come, where we're recruiting, again, we're working with a community of amazing health experts from across the world. And we're looking at health beyond what you kind of see, I would say, most of the time, which is like, you know, mindfulness, yoga, all of these these subjects are super important. I'm not saying they're not, but if you're having problem with pelvic floor incontinence, you know, meditation is not going to do that much, you know, if you want to go for a run. So it's whole body health, right? And we're going to where the experts are the best to come in on subjects that, you know, impact our health in every way, from pelvic floor to brain health to gut health. You know, we were talking to Diane just before we jumped on the call. Gut health, we're realizing how important, you know, gut health is to overall health. Gut health equals inflammation equals overall health. So bringing all that together and creating programs with each health expert, because it's one thing to know something. It's one thing to know things that we will share during this 1-hour talk. Men and women, you know, are experiencing different heart symptoms and different disease, and when it comes to heart health. But now what can you do about it, right? Like, now that you know, well, there's one thing that you need to do when you go into the emergency room. There's the way you understand, you know, your heart health. And I see that we have somebody from Her Heart Co., which is, we have a session with Frankie as well on women's heart health, which is so important because it's the #1 killer for both men and women. And things happen in midlife with women that, you know, increases our risk of heart disease. So all of that is kind of put in there. Now, I know Alyson was going to join us in like 10 minutes or so, but I'm going to get the ball rolling and kind of talk about the subject at hand. So today, what we wanted to share with you is a bit of an understanding of what the market is like and why it's like that. Because a lot of the time, we're not here to kind of bring in polarizing opinions to kind of get you to be angry at something and, you know, like politicizing everything. No, it's not about that. It's about understanding why it's like that and then what you can do about it for yourself. So one thing that Dr. Alyson McGregor talks about in her book is the fact that the medical system is male-centric. And what does that mean? It basically means that, you know, since the beginning of time, we've been studying male bodies and applying it to the whole population, men and females, with this presumption that, well, our bodies are the same with the exception of our reproductive organs. So our hearts are the same, our brains are the same, we digest food. And now what we understand and what we know is that men and women are different down to every single cell in our bodies, right? We metabolize food differently, our brains are different, we feel pain differently, we learn differently, everything is different. So then if you have something that has been only studied on men and applied to women, it would be great if it works, but we see that a lot of the times it doesn't, right? So we see that in the numbers. We see it in the fact that the majority of the medicine that's taken off of the market is because it has negative side effects in women. And this is something that we learn afterwards. Now, you'd say to yourself, well, why is this? Because when you go back to the consumer side, women are a huge part of the market. They're the majority of the market. We consume most of the medicine. So why is the medicine not made for us? Well, if you're going to launch, let's say today you decide to launch a new medicine on the market, right? It would take about 15 years for this medicine from the time that you're testing it on cells to the time it's put on a pharmacy shelf, and billions of dollars. If you test it on 100 men, for example, you're going to have pretty homogeneous results. It works this way, it doesn't work that way, here are some side effects. If you're going to test it on 100 women, you're going to get very different results because one is postpartum, one is perimenopause, one is menopause, one is in the follicular part of her cycle, one is in the other part of her cycle, so you have very different, like a variety of results more. And so then you need to include more and the study becomes longer, right? So until 1993, all of the medicine was only tested on men and then just released on the market. Then after 1993, because of the work of all of these amazing champions that we've had, like Dr. Alyson McGregor and Dr. Marjorie Jenkins, things shifted, and the government said that you need to have women as well. Hi, Alyson. I'm talking about your part. I'm talking about male-centric medicine. So I
heard me enough. You can do it.
I'm going to pass it on to you. I introduced a little bit about OM and our book and what we're trying to do with our book, but you can't start talking about it until you kind of explain the male-centric medicine and male-centricity around medicine. And if you're wondering who came up with this term, it's Dr. Alyson McGregor. So she's the one who wrote the book on it. She's the one who's changing medical books and including women in. And I'm going to pass the floor on to her. And then I'll take it after in the maybe the wellness area.
Perfect.
More.
Great. So thank you for having me. This is fantastic. I'm sorry I'm late. I have another wonderful woman who's an executive coach coming in to teach a lot of my faculty members. So I just wanted to be able to introduce her and thank her for coming. And so I have really, I'm an emergency medicine physician by specialty. And so, and I've been doing that for about 20 years. And through that, very early on, just even finishing my residency, I realized that women do worse than men in a lot of medical settings in a lot of different ways. And so I started to think, why is that the case? It seems like there's a lot of bias against women. I would see my attendings and my coaching and the doctors I had to make sure that I did things correctly in their mind, roll their eyes when there's like a woman with chronic pain syndrome or like pain someplace and the CAT scan was normal. And it's like, well, they're crazy. And I was like, why is that the case? And I really started to realize that everything that I was taught was from the viewpoint of how men develop disease, how they present with disease to the doctor, and then and all of our diagnostic tests and our medications were designed for that process. So I looked back and realized that who we have enrolled in clinical research has been men. So our major trials are in cardiovascular disease and stroke and infections and cancer. Picture all of that understanding of the human body being mostly just from the male body. And so that is what's taught to me and to nurses and to EMT and to dentists and to, pharmacists. And we've had this really just sort of male-centric understanding of human health. And now we realize that that doesn't always fit, the anatomy books are like, filled with male models. And then we have a little square that says, oh, here's an ovary. Don't forget about the uterus. We just put that on and think, okay, like it's still the same. We just have these extra things. So that's actually, been very important to figure out in why we don't fit the pattern that's being taught, why we don't fit a lot of our understanding of, diagnostic testing and the medications that are prescribed are based on the pharmacokinetics and dynamics of the male body and metabolism. So now that we really know that, and that's beginning to evolve, one of the most key points was the NIH started to realize this as well, and they made a requirement that research now has to include both male and female representatives in the study in some way. And so that's about 10 years old now. And since then, we've started to just understand the differences between men and women in such an exponential way. It's really, really exciting. How many of you are familiar with what we know about Ambien? Okay, cool. So Ambien, we know, is a sleep medication. And funny enough, not funny, but funny enough, is that it was on the market for over 20 years. The original studies tested it on men, and it's mostly prescribed to women because women are being diagnosed with sleep disorders more commonly than men, right? So women go see the doctor more, they're more likely to get diagnosis, more likely to get prescription medications. And the prescription medications were approved by trialing it in men. So 20 years, these women are taking this Ambien and they're going to bed at night, and then they're waking up and they're getting into the car and they are going and getting into a crash. They found all of these reports of these women who would wake up and be impaired. And they likened it to the alcohol and driving simulation studies. Like, you're just impaired. You can't really function. And so the FDA looked at it and they said, well, let's give a man this dose of Ambien, and let's give a woman this dose of Ambien, and we'll wait the amount of time that the bottle says you should metabolize it. So, okay, make sure you get that 6-hour sleep. And then they would wait 6 hours, and then they check the blood concentration of the medication in the man and the woman. And the woman had 2 times the concentration compared to the men, and they were given the same dose. And so this was the first time that the FDA said, wow, women metabolize this drug slower. Maybe we should have a dosing that's based on sex. So women should start with 5 milligrams and men should start with 10 milligrams. Now we have 20,000 prescription drugs that are approved by the FDA that are out in circulation right now in the United States. And that is one drug where it's been looked at to the point where there are, actual dosing recommendations. Now, there's a lot out there that's looking at the differences in metabolism of medications just by being male or female, depending on your liver metabolism, our body fat distribution, our menstrual cycle. I'll stop at and answer some questions, but one of the things I find also really interesting and horrifying at the same time is that in general, women, their menstrual cycle has really just been tied to their value of reproducing. Okay, so we have a menstrual cycle and that gives us a period. And so what we did was we said, okay, let's give that to obstetrics and gynecologists. You can have the menstrual cycle because it's relates to the value of having being able to pregnant and having to reproduce. But when you think about it, all the changes that occur in the uterus during the estrogen, progesterone fluctuations, we have receptors for estrogen in our blood vessels that supply the heart, in our brain, and affect migraines and seizures. Our immune cells have estrogen receptors on them. Our stomach lining does, our, intestines, our bladder, it's really everywhere. And so we're really trying to change the focus that the neurologist needs to know what's going on with the menstrual cycle, right? The orthopedic doctor needs to know because it affects the bone and, our ligamental strain. The surgeon, I mean, really, it's everybody's issue because it affects our entire body. So it's really lovely now that we are embracing the fact that women are much more are looked at as different from, their cells on out. And so a lot of the work that I do is in the past 10, 15 years was to really do research on this because evidence wins the argument. When I, 20 years ago, when I said, oh, I think there's bias here, everyone was like, well, prove it. And so I spent a long time publishing a lot of research that shows that these differences between men and women are actually important and they matter clinically. And now I'm really focusing on changing medical school curriculum and interprofessional health curriculum. We have a summit that we include allied health and dentistry and nursing. Really, we have to update the way that we are educating our healthcare providers so that they can really incorporate all this new knowledge in. I'll stop there.
So Alyson, what we like to do at OM is, present you with something that's happening, but also present you with how you can advocate for yourself, right? Because now that you're not gonna oh my God, what am I gonna do? Just jump off a bridge, right? What can we do? And I know so Alyson has this incredible session on the Hub called Why Medicine Impacts Women Differently, where you learn about why it does and how, how we metabolize things differently. But you share one thing that I find incredibly powerful, actually two things. One is the place where we can go to check our medicine, and two, listening to our bodies, in terms of how we feel and how to, can you take us through that a little bit? So now we've established, medicine sometimes might not have been tested appropriately on women. You might have negative side effects. What can you do about it to have a good conversation with your healthcare provider about?
Exactly. So I really encourage women that to be their own best advocate, right? So right now the medical care is very complex. We have lots of specialists. No one's really talking to each other. Everyone's ordering a CAT scan or an MRI or, and then you go to the emergency department and it's starting all over again. So I think that, it's really important for you to really keep track of your health history. So what tests have you had, what specialists, what medications you're on, how your menstrual cycle is relating to that. Really get a sense of your own, health in relation to all of these other things, because what's happening is we are sprouting up experts that are like, oh, we get this male-centric medicine. That's right. Women are different. Let me change that dose of Ambien. And that's just one physician that might have, had that understanding or that development or, education. But we all want access to the latest of this, right? Because this is so new and fresh. We want to be able to incorporate this into our own health. So that's one of the main impetuses for OM, is that we will bring together all of the health experts that we vet, that we are like, oh yes, you are talking about this new evidence, and you get the understanding that women have had a bias culture. And we put it all together so that you can pick and choose, and you can sort of, find out what works well for you as you look at your overall health, record and impact. So it's exciting, but it's a lot of it is on your own at this time until it becomes just sort of systemic knowledge. It's enough that it's there, and there's enough people that are in the know. But we don't have time to wait for me to change medical school curricula to then have the new doctor come, and then you're in menopause, and then here it is too late, right? So while we're working on changing the whole healthcare system, what can we do today? And really, that's what OM is about. That's what our books are about, to really sort of give the power back to you, with resources that you can look up medication dosing and
So
understand.
Alyson, what is the website that you give in your why medicine impacts women differently? It's the FDA one. We will share the link with
Oh,
you.
yes, sure. Yeah, yes. FDA snapshots. So it's about 5 years in the making, and every year they have a new one. So if you are prescribed a new medication, all of the medications that are approved by the FDA through this particular year, the year that you're looking at, they are their whole point is transparency. So they're showing you, here's the medication. It might be what you just prescribed, and you can see what was the efficacy, the safety, and the data in men versus women, but also age, race, and sex. So they are.
Alyson, it's so sorry to interrupt you, but it's so fascinating when you showed this to me, because you look at a medication, right? And it's very well done, consumer friendly, I would say, as consumer friendly as you can get with explaining medicine, I guess. But you get like a pie chart, right? And you get 60% men, 40% women. And it's fascinating to just kind of click through the medicine to see that most of it is like 20% women, 30% women. So it's still not like, we're not like 50-50 men and women being included. And from what I understand, this data is not often like split, deaggregated, right, Alyson?
That's the other issue. So in the beginning, the NIH was like, make sure you include women. And it was like, oh yeah, duh, let's include women. But as we start to realize that our metabolism is different and our physiology is different, sometimes you can give a medication to a woman and it will have a positive effect, and then you give the same medication to a male and it has a negative effect. So we can't really combine them. It's not about 50% men and 50% women. It's about enough women and enough men to analyze the data separately so that you can see, oh, there is a difference here. There isn't always a difference, but we have to look now because there's enough differences out there that it's blowing up women's health.
Yeah. And I think, what has really surprised me after bringing together, a community of over 150 experts, some are doctors, some are physiotherapists, some are traditional Chinese doctors, they all say the same thing: listen to your body. And that's the thing that surprised me, because I kind of thought, well, if a holistic practitioner will say it, cool. But if like Alyson says it, Alyson is going to tell you, how are you doing on this medication? It's your body that's going to tell you. Listen to that, have the understanding of how the system is, and have a rich conversation with your doctor around the subject, right? I want to, there's a part in your book, Alyson, where you talk about the things that women hear when they go to doctors, like, oh, it's just menopause, or it's just da 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 da. Can you take us through a bit of these things that women hear that they shouldn't accept, that they should not kind of just say, oh, well, and then it just, when they, kind of try to advocate for themselves?
Absolutely. And, and again, just a reminder, this is coming from the emergency department, where I see everything, no matter what can happen to a woman. It comes into the emergency department. And so what I've experienced, especially when I was younger and I was, emulating my attendings and my supervising doctors, was that if it's not, if it doesn't fit the book, then it's not, then it must be in your head. So if it's not in the textbook, the pathophysiology textbook, or if we check a CAT scan and everything, looks normal, it must be in your head. But what I really noticed is that that's because our understanding of heart disease in women is much different. It's microvascular disease. It's not going to give you this. So when women are like, I feel really uncomfortable, I've got this, oh, well, it's you must be under stress. It must be, your anxiety. The other thing that I see a lot is that women are prescribed more prescription medications than men. And so what happens is if you come into the emergency department and you say, oh, I have this, fluttering here, I'm not sure. The doctor, one of the things they look at is your past medical history. And they say, oh, you have anxiety. Is this your anxiety? It's like, well, no, I mean, sometimes I'm anxious, but this isn't what it is. And they're like, oh, but you have GERD, you have reflux. I see that you're on ranitidine or omeprazole. This must be your reflux. They're looking for something to explain it, because their understanding of heart disease in women is limited. And so oftentimes that really relates down to being believed for pain. Many women come to the emergency department, and if they complain too loudly for pain, because of pain, they're considered crazy. So then they try to be quiet, and then they don't, then they're ignored. And so there's this, gender bias from the physician point of view and the patient point of view. What's the gender of the physician? What's the gender of the patient? A lot of that is there's a little bit of negotiation that goes on, because men think women are more hysterical and louder. So they always turn the volume down. If you go in there and say, oh my God, my stomach hurts, they're like, all right, well, they're like, it must hurt like a 4, not an 8. You're acting like an 8, but it must be a 4. And then women are like, well, you're ignoring me. I'm going to make it a 12 so that you know that it's an 8. And there's a lot of the social cultural fight there, that is worse when it's the opposite gender of the physician. But
I don't know if you guys kind of heard the story of where the word hysteria comes from. And it was actually the first mental health disease that was purely attributed to one gender, women. Only women were hysteric. Yay. And it was because during Greek antiquity, again, they didn't understand women's health, and they had this idea that the uterus travels in a woman's body, and it gets confused, and then because of that, it doesn't know where to go. And when that happens, when the uterus is traveling in our bodies, we get hysteric. So that's the way that they explained it. But to this day, and this is what I mean when women's health is like an onion, right? It's not just the system that we're fighting against, because that's biased. It's also, we've been told that we're hysteric since, for millennia. That's what people see when they look at us. And then we either do two things, like Alyson says, we either have to turn up the volume because we know what's happening, or we're like, well, maybe it is all in my head, right? And I feel like just by understanding that this is the way the system is, not to feel crazy in your head. It's not in your head. There's many factors that are at it, right? And then you need to kind of find your path to finding solutions for yourself. But now it's 40 minutes in. Alyson, do you want to kind of go from here into talking a little bit about what's happening in wellness as well? And I'm gonna link it back to your story of your aunt and the meat grinder and everything. So again, when I was putting together OM and I was building a community of health experts, and Dr. McGregor and Dr. Jenkins came on board as co-founders, I was like a little bit scared of, oh, but what will they think about the fact that, you know, we're going to have hypnotherapists on OM, and we're going to have, you know, other kind of holistic practitioners. And the interesting thing is that neither of them, nor any other cardiologist, any kind of doctor that really understand health, denies the fact that health is holistic, right? So, and I think the more sophisticated and knowledgeable you are, the more you try to kind of get all the layers of health, because health is very holistic. So then how do we mitigate between, you know, Western medicine and a more holistic approach? And I really love the story that you share in your book. But before we move on from the medicine part to the wellness side, that I think a point that I want to make is that there is no reason to turn our backs away, again, the way what's being happening right now on social media, where there's almost like a backlash against Western medicine, because it's no, oh my God, we have incredible tools available to us. And we should tap into those, and they've doubled our life expectancies, and they've done incredible things, and they're helping us heal. We just need to kind of know how to navigate that and how to kind of balance it between Western and more holistic. But Alyson, do you want to share that story with your aunt, and then we take it from there?
Sure, sure. My aunt always was a rural, she lived in Maine and New Hampshire and South Dakota. She always had farms, and that was just her love and her life. And so she was grinding meat, of course, because she's raising cattle, and she was grinding meat, and her hand got stuck. And as she went over to turn off the grinder, it pushed her hand even further. And she lost all of her fingers and a big part of her hand. She only had this little piece of her thumb left. And she was a broken person. It was painful and sore, and she would hold it like this. And she didn't want to, when she would come visit, she didn't want to go out to lunch. And it was just, her whole aura was just, really down. And so I have a friend, because I believe that, Western and holistic and allopathic and osteopathic, it's a buffet. There is no one particular thing that's the way, right? So there are legitimate experts in all of those things, and you are very intuitive, because women are intuitive, and you need to really say, okay, this feels like I felt better after that acupuncture. I felt better after they increased the dose of my protonics. This is where you get to make sure that you're getting that advice from trusted experts, but then it's sort of your buffet. And so one of my trusted healers is a woman who is physical therapy trained, and she also does cranial sacral therapy. And she's just one of those angels that you go to, and she touches your body, and you're just like, oh my, not massage, but like really moving my organs and everything. So I sent my aunt to her. And after one session, my aunt walked out, and she was like, I'm cured. Let's go out to lunch. She's moving her arm around, and as for gut, she was carrying around this pain and loss. And when energetically she really worked with this woman to let it go, it was like she was a new woman. And so we don't want to prevent ourselves from having those experiences too. You could still see your cardiologist, and make sure you get your stress test, but also make sure that you do, like Anca said, it's a holistic viewpoint, as long as you have very vetted and legitimate experts. There's a lot of people out there who are really, selling things and using their influence in TikTok or their celebrity to, to sort of draw you into this, multi-gummy that's gonna, make you beautiful. And so those are the things that, like, that doesn't feel right, right? You mean, listen to ourselves. And I just wanted to take a minute because there were a couple questions in the comments. So the first was, is there a change in how OB/GYN physicians are being trained to look broadly at women's health? That's interesting. I think that it's yes with OB/GYN, but then also it's all of our other physicians. It's OB/GYN have been really carrying that load because our value has been in reproductive our reproductive nature. And so really what we're trying to do is teach all the other physicians. And you pick the doctor, whether it's, I've been thinking about changing my doctors so that I only see female physicians. Does that make sense given my research? And yes, it does. But I want, there are still really, there are men that know the difference as well. And so, again, this comes back to trusting your gut. One of the things I say in my book is that, for instance, there's a study that women who come into the emergency department with a heart attack, if they had a woman physician, they had better chances of survival. And then if they have a male physician, but if they had a male physician that worked with a lot of women colleagues, then they did better than the man who worked with just male colleagues. And so clearly, diversify. You want a diversified office building. You want to make sure that you're with people that are growing, and so you'll get the benefits of a diverse culture, brought to you. So again, it's work on your part, but I think we have the luxury of our intuition to really help guide us.
And in the book, Dr. Jenkins talks a lot about that, because her part a lot is how you build a team of great providers around you. And she put this triangle in here where you can evaluate this if you have a successful health relationship with your health provider. And it starts from communication to accountability to respect, trust, and the top of the pyramid is results, right? And that's on both sides. And what she always says, is like, if we go to a hairdresser and we're not happy with, the way our hair is, we're going to change them. If we take our car to a mechanic 4 times and it's still broken, like, we change it. So it's this mix of, I think, understanding what makes a healthy relationship, because it's not just kind of saying yes, it's about communication and so much more than that. But it's also about results. And as Alyson says, your intuition. So what the numbers say is that, yes, definitely women have better success with women. But maybe, Alyson, that's, if you kind of go see somebody in an emergency care situation, beyond that, I think you have to build a team around you that you feel like is there for your health.
Yeah, absolutely. Definitely a team. It's a team sport. And with that being said, one of the things I find most effective is when women bring an advocate with them to the emergency department or to the doctor's office, because they'll come in with their headache and feel as though they're not being, taken seriously. And if there's someone else there that says, this is my partner, this is my relative, my friend, and she doesn't usually do this. This is not her normal migraine. Something is different. I know her, and we wouldn't be here right now. That quick little piece of information, that sort of advocating for someone else, goes a long way. And so I would encourage us to do that for our people, and then ask for that to be done for you too, because it really does. It just sets the path of the process, especially in the emergency department or anytime you see the doctor. It really helps to say, this is not her panic attack. I know that that's listed in her past medical history, but that is not this. And then the doctor's like, oh, okay, like, I have context now. I'm not going to go to the easy bucket of, this is something that, you've already had before. So I think that's important.
I have a question
Diane?
too. Yeah, I mean, I'm just so excited about all the work that you all are doing, and grateful as well. There'll be information in the follow-up email, as I mentioned, about OM. and the amazing library that they have of resources. And in the age of AI and too much information, honestly, I'm grateful to have vetted sources of healthcare where, quite honestly, often I don't know where to begin looking, and that's even with a background in healthcare. I was wondering, in your library, are there a few sessions that you could recommend as teasers when people subscribe and start thinking about it that may have been misunderstood before and answering questions that we wouldn't have even known to ask before?
Sure, yeah. I mean, so I think a great one is Dr. Alyson McGregor's session on why medicine impacts women differently. Because she goes through it, and then she gives you with every session, it's also about the resources. But I kind of think, you go and you see, because we try to go beyond tick the box subjects into where women are really kind of doing what women are doing with their health. So what I mean by this, up to 20% of women suffer from chronic pain with sexual intercourse. 20% of women, that's a huge number. And that's not something that comes and goes, that's all the time. And it has such a huge impact on quality of life. And so we have a session on that with an amazing health expert out of New York, who explains to you what that is, why it's happening, what tools there are, how you can talk to your health care provider, who do you talk to about this, all of this. So it's almost like you come in and you kind of see if there's things that are relevant to you or your struggles in that way. I'll say be careful with, obviously, like Dr. Google and all that, there's many problems with that, but even with AI, because what Alyson said is our AI pulls the information that's out there already. And if the information is biased, it's bias in, bias out, right? I say AI is actually great because it filters out all of the sales things that are being pushed at us. Oh, you have brain fog. Here's a collagen powder, here's something to balance your hormones. AI is good for kind of cutting that noise out, but it's still, biased information in, biased information out. So you're not going to get the most cutting edge of health. But one that I recommend to all women, because I think it teaches you so much about health, is we have this incredible session on the power of bone health with Dr. Christy DeSapri that talks about bone health for women. And there's so many lessons in that, from, the fact that 80% of osteoporosis diagnosed is in women. Why is that? Big part of it, it's highly, highly preventable. What can you do? When? Right now. Now is when you can prevent it. What tests are there to do? Don't miss out on these tests, because what happens with osteoporosis is, instead of diagnosing it in time or seeing that there's an issue and starting the process to prevent it, we notice it when there's a fracture, when the osteoporosis has already set in. So the power of bone health, I find like a really well-rounded session, but all of them, I love all of them. Yeah.
I'll also put a plug for Dr. Jenkins, because
Yeah.
kind of like when I talk about male-centric medicine, it gives you a framework of like, oh, that's why I need to find this updated information. It's not like I can just go to that same old source. And she does that sort of introductory of medical gaslighting. And that's what's happened when we don't fit the the standard, because the standard has been a 70-kilogram white male. When we don't fit that standard, it's been seen as our problem, because we don't fit what we've been taught. So it's our problem. It must be, because it's not, I went to medical school and this doesn't fit anything. And so it must be in your head. And so just realizing that's years and decades of bias that has just been carried forward. And that's what we're trying to change. But if we just let like, okay, this is gaslighting, you may not realize it yourself that you've been taught bias information, but I just learned that you have. And what you're saying is not, it's not me. It's just the science doesn't know yet. And I'm going to try to find someone who knows more than you.
Thank you. Well, our hour's almost over, and we could keep talking for another hour. My goodness. I'm going to hand this over to Meg Sullivan, who's Quorum's founder and CEO, for a wrap up. But thank you both.
Thank you.
So Alyson and Anca, thank you so much for spending so much time with us as an organization. The subject matter is so important, and we're so excited to see the work that you are doing along with Marjorie Jenkins on these topics. I think it's so critical. I believe it was the beginning of the year, McKinsey did a huge report. It was all tied into what was going on at Davos, because they tried to do a little bit of a focus on women at Davos, which is a start, it's a start. So I'm excited about that from a starting point. But I think one of the articles that they did on women's health, between the lack of research data and misdiagnosing that's kind of going on, it's actually they consider it a $1 trillion opportunity globally around women's health. That's how big the problem actually is, which is quite fascinating if you think about it in that. Or it blew my mind, I guess I should say myself. It blew my mind because I don't think I understood the depth of the problem, which both Anca and Alyson really tried to break down for us a bit today, in terms of how long this has been going on and how little has been done to date. Yet there is hope. I think there's a bright light, which is what's so great about the Health Hub and all the work these three amazing women are doing to try and raise awareness and get information into the hands of women. I loved, Alyson, you kind of gave me big things to think about. And that was doing a really good job of tracking your own health and your own health journey and how you're handling and taking care of all that information. I have to say, when you said that, I was like, oh my God, I'm so irresponsible on that front. I've kind of handed that over to the various experts in my world, and I'm not sure I've ever asked them to tie things together for me. So that's one. And two, I don't know that I have easy access at my fingertips about my own information, which is crazy. So thank you for reminding us how important that is. I love the notion that you talked about listening to our own bodies, because at the end of the day, the people that know best is us. So we just have to believe in ourselves enough and not be talked back at. Alyson gave so many beautiful stories about being careful about that, allowing others to dictate an answer that's not actually our answer, So I thought that was terrific. The notion of listening to intuition, it's one of the most amazing skills women have, in lots of strength, is that notion of intuition. So really that goes back to that listening. I love the notion of health being a team sport, because you're seeing more work being done in the healthcare system in general, where the doctors are working together a little bit better, but it's still kind of far away, I would say. But I love the idea of us thinking about that for ourselves. Is how do you create that entire team that's supporting, whether it's Western or Eastern and all of the above care, how are we really thinking about that as an entire universe, for ourselves. Loved that. And then I really think it's important, this notion of having someone with us to help advocate, because I feel like that's such a big missing link for me. I'll talk to me, and I've been trying to do some work and care for my own mother, for example. And if I wasn't in the room, I can promise you the outcomes for her were going to be very different than they are currently. So it's easy to do it for others, but we need to remember to do it for ourselves as well. So I really appreciated all of those. Those were some of my big takeaways, in addition to all the great information that you shared. So thank you, because it was just fabulous and so rich. And obviously there's so much more that we can tap into because your work is ongoing. And we're so delighted to have this partnership with all of you and watch you really get the word out for women's health, which we just couldn't be more appreciative of. So thank you, both of you so much for taking time out of your busy days, and Anca staying up very, very late to be with us today.
Anytime.
So I just want to end the whole call on, we're going to actually continue a bit of this conversation at Quorum's How Women Lead Change Forum in November. And so we will continue to explore this concept of women's health and what's our role in helping to evolve it along with these amazing experts. And how do we continue to push for the things that we need and, effectuate change. So this conversation is going to continue, which I don't know about you, but after today, I'm really excited about that. And so if you haven't already, we invite you to sign up and join us for the How Forum it starts on dinner time on the 14th and a full day of activities on the 15th of November. And would love to have all of you be there with us and participate and continue on with this dialogue. And the third leg of the stool, Dr. Marjorie Jenkins is going to be joining us there in New York. Alyson, I can't remember if you're available too, but I know she's definitely going to be available. And so it allows us to really, have some continuity to what we've discussed today. So anyway, huge thank you, Anca and Alyson. So great to see all of you on the phone today. I look forward to us sharing this out to Diane because this needs to be an ongoing discussion, probably forever, while we really work on getting changed on, more broadly. So there's a lot to do, and I'm really excited about it, and so appreciative that everybody took time out of their busy schedule to be here with us today. So thank you. Have a great rest of your week, everybody, and look forward to seeing you again soon.
Thank you, Meg. That was an amazing wrap up.
Meg and Diane.
Awesome.
Thank you.
Appreciate it.
Yeah, no, listen, thank you, honestly.